Good afternoon. It is 4 o'clock. We continue to show school pride out there. This is from Connor Middle School in Boone County. They are the Colts. We appreciate them getting their school pride out, making sure that when they come back on September 28th, that their group is masked up and that they can show a little bit of joy in doing the right thing for their fellow human being. Let's look at today's quotes. We've been enjoying these at the beginning. You know, quotes often come from nuggets of wisdom, which means they've been provided by some pretty smart people and they have stood the test of time as good advice. Today's is about patience, continuing to talk about patience, not being driven by anxiety or simply what you want to do, not ignoring the facts that exist and that every public health official is telling us about, but making sure we are driven by true facts and we have the patience to follow them and what they advise us to do. So patience is not an absence of action, rather it is timing. It waits on the right time to act for the right principles and in the right way. This is a former Archbishop, Fulton J. Sheen, had a television show for a while. But think about that. Patience is about choosing the right time to do something. It's a pretty important lesson in the middle of a pandemic about when something is or is not safe. Timing. Timing's important for success. Timing's important for safety. And the lesson of patience is about making sure we do the right thing at the right time. And I'd submit to you that some of the states that are out there that rush to reopen way too fast, that have some of the highest positivity rates in the country, are also rushing to do other things, and we're seeing a lack of patience in many states. 1 week into school reopening, Mississippi is quarantining more than 2,000 students and 500 teachers. That's not okay. That's 2,500 families because there are other people who are going to be quarantined because they were in contact with them based on 1 week. Those are families going through the fear that comes with this virus. You heard Rocky stand up here and talk the other day. That means there are grandparents quarantined with the grandkids they take care of, with people wondering whether they're going to make it or not. And you have those kids that, while we believe that this virus won't kill them, that are wondering about what the long-term impacts are because we still don't know. I hope they have access to the help and the care they need. I want to have more patience than this. I want to select better timing than this. In everything we do, I want to make sure we are learning from others and we don't need to be the ones making mistakes in the middle of a pandemic. All right, let's start with some good news today. We have some more CARES Act funding. This time we're highlighting different local governments in central Kentucky. Again, our local governments have been on the front lines of helping us fight this pandemic, of trying to ensure that our people are masking up right now with Mask Up KY and making sure that they can provide for public safety at a time that's so difficult. So today I'm announcing $8 million of final approval to 18 local governments in central Kentucky. They're the counties of Henry, Mercer, Oldham, Shelby, Spencer, and Wayne, and the cities of Berea, Bloomfield, Crab Orchard, Jeffersontown, Lawrenceburg, Lebanon, Middletown, Pee Wee Valley, Shelbyville, Taylorsville, Wilmore, and Winchester. Again, this funding helps to reimburse costs associated with fighting this virus. We appreciate all the local leaders that are out there. We hope that this helps to solidify their budgets because there are so many important things that our local governments do, and we've got to make sure that they emerge from this healthy, just like state government. Today, we're also announcing that we will be applying tomorrow for the FEMA Lost Wages Assistance Program. That's the $400 in additional unemployment that we can provide our people that are struggling through these difficult times. As you know, originally the federal government provided an additional $600 for those on unemployment in the midst of the coronavirus pandemic. That $600 we saw move through our economy, keep businesses afloat. People are having to spend it because they need to survive, to provide for their families, to put food on the table. And while there is still some uncertainty in this new program, it is just too important to get these dollars to our families. So the Labor Cabinet will file an application tomorrow. The program will allow Kentuckians receiving unemployment benefits for the weeks of July 26th to August 15th, that's what we're starting with, to receive additional payments of $400 if they're unemployed or partially unemployed as a result of the COVID pandemic. The $400 will apply to all programs. This is important. Traditional UI, the Pandemic Unemployment Assistance Program, and extended benefits programs. At this time, only 7 states have been approved for the program: Arizona, Colorado, Iowa, Louisiana, Missouri, New Mexico, and Utah, and all have chosen to just do the $300 option because the federal government will pay for that full $300. I believe that extra $100 is critically important. So we're going to use CARES Act money to help get to that full $400 threshold. Kentucky's portion will be roughly $8 million a week for a total of $24 million over the 3-week initial grant period. Now, we know how this money moves through the economy. We know how important it is to these families. And while we need this money, in case that Congress decides that they're going to allow us to use some of this CARES Act money for budget stabilization, right now it's just too important to get it to our families, and knowing that it does, as it cycles through our economy, come back and positively help our budgets. We believe that we will be the first state to apply for the full $400 under the President's executive order. We believe West Virginia and North Carolina are also considering that extra $100 that the state pays for. Once the application's filed, FEMA should approve it. We've heard 24 hours, but they say 48 to 72 hours. And once we receive approval, we have to reconfigure systems because this is being administered in a different way than the $600. It is different. The approval process is different. So it's going to take us about 2 weeks to get the system in a place where it can process and send out those payments. And that's us working fast. Again, if this had been done in the same way the $600 payments had been done, we could pretty much just keep it going. But this requires us to reconfigure what is an ancient system, but to get those dollars out. Benefit recipients should not expect the payments until early September, but they will be for those weeks. The initial FEMA grant is for 3 weeks. Once those benefits are paid, we'll look at what is feasible moving forward in the future. So we believe this is good news for our families. We believe this is us taking the lead in providing for our families. This was something that I think the Senate Majority Leader was pushing us to do, but we needed the information and the guidance that wasn't there until very recently. And I will tell you, we're moving so fast on this. Many governors that I've talked to hadn't even seen the application. I know it's out there now. And we hope that ultimately every state will do something to help out their people. It's a 1 in every 100-year pandemic. Let's look out after our families. All right, today's total new cases of COVID-19, 655. Still has us in the general range as last week. Remember, we always see more cases on Wednesday, Thursday, sometimes even bleeding in to Friday. Of the 655 new cases, 91, which is 14%, are kids, 18 years and younger. It brings our total number of cases to 40,926. And today we've got 12 new deaths. I don't remember 2 days where we had this many deaths back to back. And it's the result that we talked about earlier, that when you have 3,000 cases a week, the deaths follow a couple weeks after. And we're at that point now. We said it was going to be a tough August. We're at the point where we're starting to see the deaths that have resulted from this spike. Remember, the longer that we stay up here with 4,000, 3,900 cases per week, we're going to see more deaths. So I hope that we are committed to doing what it takes and making smart decisions to get this virus on the decline here in Kentucky, to get it spread on the decline. not just so we can safely reopen schools, but so we have fewer people that die here in Kentucky. You know, we hear different people talk about this that almost remove the virus and its toll. But we've now had 842 Kentuckians die. I'll compare that tomorrow, but that's more in several wars that we fought. 842 Kentuckians. And how many more die depends on how many of us wear a mask, how many of us follow the guidance that we know works, the decisions that we make moving forward. And most likely they even impact the community that you're in making those decisions. So it's really important that we do this right, since we're going to be seeing the human toll, especially as we move through this month and where our cases are now, next month as well. We've now had over 785,138 total tests in Kentucky. 9,331 people recovered. 640 Kentuckians currently in the hospital, 155 in the ICU, and 90 on a ventilator. Pray for them. Current positivity rate, 5.41%. Our deaths today, Garrett County having its first loss, a 78-year-old man. Letcher County, a 72-year-old man. Barron County, an 82-year-old female. Harlan, a 75-year-old female. Oldham, a 62-year-old male. First death in Hart County, a 58-year-old female. Butler County, a 79-year-old female. I think this is the first death in Mercer County, an 82-year-old male. 2 people have passed away from Logan County, an 81-year-old female and a 91-year-old male. We lost an 86-year-old male from Barron County. This one will hit you pretty hard if you're somebody like me. 42-year-old man from Warren County. I'm a 42-year-old man from Franklin County now. 42. No one on this list should have left us before their time. Not a 91-year-old. There was still time for that individual, for their family. Heck, they might have great-grandkids. The opportunity to get to know them. Never accept those comments where someone says, this just takes the lives of our older Kentuckians. Our older Kentuckians count just as much as everybody else. But it's also not true. Losing a 42-year-old, that should prove it. We have 40s, 50s, 60s, 70s, 80s, and 90s today. It's just hitting all of us. And it's all over the state. When we look at cases by county, 180 new cases in Jefferson, 42 in Fayette, 30 in Warren, including 5 18-year-olds. Could be high school seniors, could be freshmen at WKU. 25 in Franklin County, right here. 21 in Scott, 19 in Barron, including 1 high school-age girl and 1 elementary school-age boy. I hope the contact tracing is going on right now. 19 individuals in Bullitt, 18 in Christian, 14 in Davis and Pulaski, 13 in Marion and Shelby, 12 in Hardin, including an elementary school-age kid. That's more than a dozen in the last, 5 or 6 days. 11 in McCracken, 10 in Clark, 10 in Kenton. And then as you look down today's, again, it reminds you that this can break out and move in places that we don't always see on this list. Johnson County has 8. Mason County has 6. Even counties that Greene County has 4. This thing pops up and can grow. Martin County has 3. I'm not sure I remember another day where Martin County had 3 in a single day. So it is all over. And remember, we've provided not only the state information we get, but there's also the White House, which has noted the number of counties that we have, over half of our counties that are in their danger zones. It means we're in the midst of statewide spread that we got to stop. And I believe we can stop. But you can't address a problem without admitting there is a problem. And so, again, here are the red zone counties. And this isn't, I'm not going to believe Andy Beshear. This is the Trump administration that puts this out. So if you're in one of these counties saying we should open things up, then you're not believing the Trump administration. You're not believing the Beshear administration. I guess you're just not believing. To address a problem and to get to a better place, we got to recognize the problem and take the steps needed. And let's show the yellow counties. Yeah, it's a whole lot. It shows you again where this spread is and what it's going to take to stop it. Let's look at long-term care facilities. Today, 25 additional residents, 17 additional staff, 2 additional deaths, 1 resident and 1 staff. 2 additional Kentucky facilities have outbreaks. But I will say this, and I think we can show it to you tomorrow, I hope, in a graph form. We're now starting to see more of a percentage of our daily deaths being outside of long-term care than we have thus far in dealing with this virus. That it truly shows you where community spread is, and it means that we got a heck of a job in front of us, but I believe we're up to it. We got to be ready. All right, good news about what's going on in the community, because I will tell you every day that I look around, we see more people wearing these. And that's why we are not Alabama, Mississippi, Texas, Arizona, or Florida. It's because of this. And it's because of people. People like Kevin here. All the daughteries, this is their family, masked up, doing their part. When we embrace this, when we fully embrace living out, to me, what is my faith, taking care of your neighbor, and if all it takes is a mask, heck yeah, that's something that's a pretty easy decision for me to do. Once we take a little bit of joy in this, like you get from all of them, is the day that we start winning against this virus. We start moving our counties out of the red and out of the yellow. It is something that we can do. What about Madeline Potter, who is providing free face masks for those that are in need? They'll be in front of the school daily until they run out. So I think this is pretty special. We've got schools that have opted to do what I believe is the safe thing, to start with NTI, to delay in-person classes until the 28th, and they're still handing out masks. Isn't it amazing how our educators never stop? Even in the face of a virus like this, they keep going to do their very best for their kids. Our educators are amongst some of the best of us. And I just want to make sure that we are also the best of who we are to them. Remember, our teachers, our educators, everybody that's in that building is going in with significantly less PPE than our healthcare workers, who we have celebrated and tried to protect. And the contacts that our teachers, our educators are going to have is going to be significant. Let's just make sure that we're making good decisions for them. They matter. Their lives matter. All right, this is in Meade County. This is the Lincoln Trail Health Department, but this is Tom Bridge, pastor, and the E911 coordinator. Appreciate him stepping out and showing a good example. And let's show the last one. This is what I see every night when I look out the window. Those of you that haven't been to Frankfort that watch this, the governor's mansion is right across the street from this. I have a daily reminder every night and every morning, because I get up before that sun comes up, of our loss. Every night and every morning. This is probably the largest green light in the state. If there is one that is bigger, somebody send in the picture. But it reminds me of our human toll. I can only really remember 2 or 3 days going back to the middle of April, maybe even early April, that this wasn't green. And losing 24 people over the last 2 days, that's very serious to me. Let's make sure that we care about one another. We had that quote a couple days ago or yesterday about a crisis brings out our character. Let's make sure that we pass that test. Dr. Stack, did you want to give us a few words today before we open it up to questions? All right.
Governor, thanks for the opportunity. Today, no facts or figures or specific numbers, just a general message. So, this started March 6th. We're at least 5 months into this journey. People are tired. We're all tired. I know the workforce that I supervise is tired and exhausted. We want to get back to our normal lives. People want to find ways to get back to normalcy. People sometimes grasp for things that are not going to be that path. We give data, we give facts, we give figures, and the governor shared his thoughts on the data, that we strive so much to give numbers and information, and I acknowledge repeatedly that it's not perfect, but it's very useful. It's incredibly useful, but it does require some informed interpretation and honesty when things take a different turn or when things don't turn out the way we expect. It is difficult, and I don't just say this in Kentucky. I talk with my fellow health officials from around the country. We have regular engagements and communications. It is difficult. I think your public health workforce, who is incredibly committed to supporting your health and well-being, does find it at times difficult to avoid getting a bit demoralized. We're not here to separate people from their activities and from their schools and from their jobs and from their social activities. We're not here to do that. We don't want to do that. In fact, we will get back to a time at some point when I can hopefully have the chance to talk to you less frequently, but still talk to you about the importance of physical activity and social engagement and connectedness and supporting each other in different ways. But we can't rationalize our way to getting out of this. There's a bad disease out there. It spreads really easily. We have no vaccine. We have no cure. We have no treatment. When it hits people hard, it hits them real hard. It overwhelms hospitals. It causes a lot of people to lose their lives. When you look back at statistics, I'm going to make myself, I'm going to give you some thoughts here. You look back at the city of New York and you compare 1918 to 2020, so you take the Spanish flu and you take the COVID-19 crisis. When you look at the number of deaths, all-cause deaths in New York City, the 3 or 4 years leading up to the Spanish flu, it was nearly a threefold increase in deaths when the Spanish flu went through New York City 102 years ago. You look at COVID-19, New York City, all-cause deaths, it is a fourfold increase in just half a year over the 3 previous years of all-cause deaths. 50 people per million, or 50 people for 100,000, I think, deaths in New York City, all-cause over a whole calendar year for the 3 previous years. They already have exceeded that by a factor of 4 in just the first half of this year because of COVID-19. And the best estimates that I've seen are that 1 in 5 New York City area people have been infected by this virus, 1/5, which means there's still 80% of New York City susceptible to this virus and able to get sick. They could have the same thing happen 1 or 2 more times in that city, and they're one of the cities that get hit hardest among the whole country. So folks, we want to inspire you to do the right thing. I want to inspire you to do the right thing. We want to support getting back to our activities. But whether it's opening schools or getting back to sports, I realize sports are like religion for a lot of folks, but we can't fantasize our way to say we're going to believe what we want to believe and harm won't happen. So I just got to urge you as we weigh our risks and benefits for these different things, to please listen to the public health folks. You can listen to people in a variety of different states if my flavor of it is not to your liking. I don't think you're going to find too much inconsistency on these key points. Every single one of us is saying wear these masks. Every single one of us is saying stay 6 or more feet away from each other. Every single one of us is saying wash your hands. All of us are saying screen yourself for infection, stay home if you're sick. And all of us are saying participate in contact tracing If we don't do these things, people will make their choices, others will get harmed, and it's going to lead to the shutdown and closure of things more than we would otherwise have to have if we just follow those guidances and do the right things. So on a very human level, I have to urge and encourage and please beg you, do the right thing, look out for each other, be kind to each other, don't make this confrontational. It's not about confrontation. We're all in this together, and we all just want to get back to doing the stuff that we miss so much. And hopefully, when we enter 2021, we'll be giving people vaccines and be able to neutralize this threat and get back with things the way we used to know it. Thank you, Governor. I appreciate it.
All right, we've got a full house in here today. I have some written questions here as well, and I can never remember which side I started on yesterday. I think I started over here. That's really honest, Lawrence. Thank you. So, Catherine.
The Attorney General just issued an opinion saying the state cannot force the closure or mandate the closure of religious schools that are complying with social distancing and other COVID-19 recommendations. What are your thoughts on that, and was that something that the state was gearing up to do?
Nobody's trying to close any school that's complying with guidelines and preventing outbreaks. I don't know where that came from. Joe?
Spoke to Senator McConnell earlier today, and I asked him about federal CARES Act funding for state and local governments. Your points about the issue between there being flexibility with the previous round or not, and how that might hinder your ability to spend it. He basically criticized Kentucky for only spending roughly 6% of it so far, and said that there are a number of things that money could be spent on if the state wants to justify asking for more money to go to state.
This is the answer is the same as yesterday. If somebody says, "Oh yeah, you got a really terrible budget coming up, and I might provide new CARES Act money for it, or I might make you use money you've already been given, but why aren't you spending money that's already been provided?" Until you make that decision, right, the state can't make a responsible decision on how to spend those initial dollars. We spend all the initial dollars, and listen, today we announced we're spending $8 million a week for that 3 straight weeks to help on unemployment. But if you don't give us any type of certainty, we spend all of the initial CARES Act money, and then there is not another round. What suffers in the next budget? Education, health care, things that we all care about. I mean, at this point, what we need is, if the federal government is not going to provide additional state stabilization, go ahead and give us the additional flexibility to use the initial round on our current budget issues. You cannot spend that money on the things that we are going to need it most for. So again, it's the rock in the hard place, and it's still there. And any concept that we're not going to give you state budget stabilization until you spend the dollars that you can't spend for state budget stabilization, and after spending them, we may say you should have held them to use them for state budget stabilization. That doesn't allow for an informed decision. Tom.
Thank you, Governor. You said you will only be participating for 3 weeks in this. What would it take to extend the state's participation?
The initial participation on the application, I believe, is 3 weeks on the additional unemployment. We fully intend to provide additional unemployment further. It's going to depend on the amount of money the federal government has in. Remember, we were concerned that it could run out after 5 weeks, for instance. It's also going to depend on whether or not Congress comes back and does this, and in many ways could do it in an easier way. That's not criticizing the president for doing what he could do, but if Congress would come back in and say, fine, $400 all funded by the federal government in the same way that we did it the last time, that'd be easier to implement, and I'm sure everybody would be happy with that. All right, if a district is returning to in-person classes but COVID tests in their area are restricted to those with symptoms, how are teachers supposed to get tested? Can you put up the state map for testing, James? We have over 200 facilities all across Kentucky, many, if not most of which, don't require that a person have symptoms. This question is from a reporter in the Louisville area. There are at least 2 options in that area to get testing even if you don't have symptoms. One is the Norton testing, that is community testing, and the second is the U of L testing. Those are both partnerships with the state. You can go online and sign up for them. That testing is free. Also want to announce that our Kroger testing is back in Lexington. We're going to have about 2 weeks where Kroger is going to be doing that testing. We want to make sure that we get as many people as possible registered. It's the same registration. We didn't know that we were going to have Kroger back, but they were willing to help us bridge the gap. We know that there have been testing shortages in this area, and so let's make sure that we fill up all those appointments. Joe?
Yesterday you said you expected a big announcement on evictions today, and I noticed there wasn't one. Can you say what the...
It's going to be tomorrow. It's going to be tomorrow. The question is, I had said that I thought we were going to have an announcement on evictions today. We are working on announcing what will be a program and have to get some of the final details on the administration of that program. And admittedly, I'm pushing people to move their timelines in that up and up and up and up. What normally happens in state government, but admittedly when I was in private practice too, is somebody tells me they can do something in 4 weeks and I ask them how about 4 days, and then hopefully we get some very short amount of time. Nick?
Student athletes were at the Capitol today where the Mets said let us play. Meanwhile, others have called for, I guess, local leaders to decide if their districts will play sports. What's your message to student athletes right now?
My message to student athletes is let's make sure that it's safe and let's make a wise decision that gives you the best opportunity to play your season. I haven't heard the final of where KHSAA is going to come down. I've gotten a little bit of information on different things that are considered, but I would just say let's be smart. You know, if we rushed ahead with a high contact sport this week, with what we have, the number of tests, the number of positives out there, I can think of at least 3 football teams that have had outbreaks related to the weight room or conditioning. What would be the percentage that we could finish the season? What would be the likelihood? I hope people will consider that too, because I think those student athletes want to be able to have as much of a season as possible. And so what does that mean? It means we need to look at the data and, if necessary, be patient. We got to think about whether or not, if you start now, you'll play 2 games and the rest of the season may be canceled because of COVID, or if we're patient sometime during the school year, you might be able to play 8, 9, 10 of them and have a championship. So I just tell people that just because we've always done something one way doesn't mean that that's the best chance to have the biggest or fullest experience that's there. Listen, I want my son to be able to play middle school baseball. I think he might be able to make the team, though he'd be in one of the youngest areas. But I want him with the best shot to play as many games safely when they do that. Lawrence?
I ask this question in the context of Senate leadership again expressing concern about your administration's handling of the unemployment insurance situation. The question I ask is this: will this new benefit, additional benefit, put extra strain on an already strained system?
So the Senate leadership apparently had a press conference. I've only gotten bits and pieces of it where they've criticized handling of unemployment, but I got a letter 1 day ago, 2 days ago, asking them to do the extra $400, which is what we're doing. Sometimes I worry that there is more concern about attacking than doing the right thing. And I'm just going to continue to do the right thing. Every time that there is an extra thing out there we can provide our families during this hard time, we want to. Will that provide extra strain? Sure, but it's the right thing to do. And I know our people are going to work as hard as they can. Let's also not pretend we're in a vacuum. Every state is struggling with unemployment systems that have, our computer system was put in 2000. Our workforce was cut by 95 workers about 3 years ago, and every state is struggling with just the huge demand of what I hope is very short-term unemployment. But going back to another question, I will say that I believe that just about every economist would say whether or not we can bounce back, or the amount of time that it'll take to bounce back in our economy in large part depends on whether or not we get budget stabilization. That if you have to significantly cut budgets of local and state governments, it takes longer to bounce back from a recession. Sure.
Does this mean that people who are still waiting for their benefits will have to wait a little longer because of this?
No, people who are still waiting for their benefits, it is in process. Again, for most people, it's that 2-page letter that's left to get out. We believe that the numbers, especially for March, are going to improve significantly over the next couple days. I think it takes 48 hours for those numbers to change based on the processing of the system. So this will be a program that, again, we can't provide these dollars probably until the very beginning of September, but starting it now means we can provide it in the very beginning of September. Catherine?
I know some universities in other states have had to close down already. UK, I believe, is at about a 1% positivity rate right now. What do you think is the criteria and threshold that universities should be looking at when it comes to continuing with in-person?
The question is on universities and what's the threshold to in-person classes. We need to look at the data and talk to any of those universities. We are, however, going to begin tracking by university. UK is putting that information out. There had at least been comments that others might not. Students and parents of those students at universities and the faculty deserve to know overall the number of cases. Now, you do want to protect people's identity, so there are certain things that you don't put out. Some things that we would probably look at are they clusters of people that are very close together? Could it be one fraternity or one sorority that's making up a large amount, and can you effectively quarantine them? Is it a wider community spread? And you know, I think what we're seeing across the country is very concerning. And we need our college students to. We really need them to to be better than just about any college student when you think about what we're asking them not to do. But we also ought to be realistic as adults that there's only so much that we can probably expect. Let's see. Will sports, band, and other activities be able to practice, rehearse after school play games if students are not physically coming to school? That answer can be yes, depending on how it's done. Can you get an entire marching band together, closely practicing? That's tough. But can you get smaller groups, pods like we currently have with different practices together? Sure, you can. So if you're smart about this and you can mitigate the risk, you can do some of these activities under guidance that's out there and has already been allowed during the summer. We also have guidance out now to where our schools that are waiting are going to be able to bring in small groups of students, get them their Chromebooks if that's what they're doing, make sure that they meet their teachers, and then get them out pretty quickly too. It's about limiting the duration of time, but also knowing that schools need that flexibility to make sure they can establish the relationships that they need to. Tom? Oh, I'm sorry.
No, you're fine. I saw with the FEMA unemployment assistance program now, or the lost wages program, that at least one state, I believe Arizona, is making their payments retroactive to August 1st. I don't know if Kentucky has considered making the payments retroactive to a certain date, or if that makes sense for the state to do, since we're only going to be doing it for 3 weeks. What are your thoughts on that?
Let me look at my notes on that. We certainly want to. Yeah, our program is going to go back to July 26th to August 15th. It's just going to take us a little bit to get the program up and going. The question is about making the request for the extra $400 retroactive, and we're taking it all the way back to where the $600 ended. Tom?
Okay, thank you, sir. I want to piggyback on something Catherine was talking about. You're talking about the universities and positivity rates, and I kind of wondered, since you will be reporting the K through 12 schools that have high positivity rates, will the state be doing the same thing with universities,
Yes.
public and private?
Yeah, the state is going to have the same type of reporting system. It's going to work a little bit differently for universities as well. We were working on that today.
Senator President Stivers in the press conference upstairs just now said that he doesn't trust your COVID-19 statistics. Can you want to respond?
Sure. Apparently, the Senate president said he doesn't trust our COVID statistics. Every positive has an individual related to it, with an age and a county. Every day we go through and remove duplicates. We have a committee that ensures that the death numbers are accurate. Now, our lead epidemiologist talked about how we have to go back through each day and we audit it to make it better. And I think that that's something that the Senate president has grabbed on. But listen, you got data from us that shows you that we're in a concerning place. You got data from the White House that is similar, so I guess the Senate president disagrees with the Trump administration. But here's the problem. When you just want to do what you want to do, you attack the data, whether it's ours or the president's, and you're not going to believe anything we put out there. But here's the thing. I mean, folks that just want to do what they want to do, or Senate leadership, I mean, they're not making decisions with Dr. Birx. They're not making decisions with Dr. Stack. They're making decisions over Dr. Pepper. I mean, you got to have the public health advice. You got to look at the actual data, and it is undeniable about where we are right now. I mean, we're in the midst of a worldwide health pandemic, and some just want to ignore it. Why? Because we want to do stuff. Listen, I want to do stuff too. But the first thing I'm going to do is make sure we save lives and protect our kids. Nick?
Sorry.
We'll do him, and you get to close this out.
Some families in Georgetown are a little concerned about a long-term care facility. So essentially, just quickly background, they are remodeling the long-term care facilities, which means construction workers can come in and out. Meanwhile, there's already been one reported death, and there are other cases that have developed. Is there rules that allow this? And I mean, is that something, I mean, is that okay?
So the question is about a specific long-term care facility that appears to be doing construction with folks coming in and out. That's concerning to me. I'm seeing Secretary Eric Freelander here, and we're going to need to look directly at that. Any other comments? Yeah, I would say it's news to me, and we're going to have to make sure that that's being done safely. Having construction as usual at a facility, especially. Yeah, we want to look directly at that situation. That is, in the very least, concerning to me. Okay, and Secretary Freelander is now going to correct everything I said.
This is depending on the facility, but what will happen when there are questions like that is our infection control team will reach out and make sure that the proper PPE is being followed, that proper sectioning off of the facility is followed, and our Office of the Inspector General will also go in if there are complaints and concerns and inspect to make sure that things are happening in the proper way. So probably need to get with you after and find out which facility, and then I can be more specific about what our response has been.
All right, Lawrence.
That's eligibility requirements. I think you have to be making already at least $100 a week to get it. Any idea how many Kentuckians will qualify for this?
The question is how many Kentuckians will qualify for this new unemployment benefit. Let us get you that specific number. We've been able to calculate our cost based on it. So, $100 a week, $8 million. So it's going to be a significant number of Kentuckians. Certainly in the hundreds of thousands and where we are right now, and we're doing it across all the different types that we talked about the pandemic unemployment, about the regular unemployment, and that was one of the things in the initial application that I think has changed about who could get the dollars if you didn't put in the extra $100. And so this has been a work in progress, both from the federal administration and from our side. But we believe, at least right now, that everyone who qualified for the $600 will qualify for the $400, but we'll provide some additional clarity on that. And I can tell you that if there's limitations, it won't be on the state side. This is a time when we want to make sure that we're there for everybody. And while it's taken us too long to be there for many people, We have always tried to make sure we can include as many as possible. All right, we're wrapping up a little bit early tonight. We went over a little late last night. We'll be back at 4 p.m. tomorrow. Just remember, we can do this. We can beat this, but we don't do it through denial, claiming that this isn't a problem or it's just a flu. We don't do it through rationalization. I don't believe the numbers, or I'm going to do my own back of the envelope math. We first accept that there is a problem. We then get the best facts, and we have public health experts on how to address the problem. And then we take those steps that we know will help us to triumph over the problem, and we put them into action. I'm not making Democrat decisions. I'm not making Republican decisions. I'm making public health decisions to protect our people. Now, I can't control whether if other people get political about it. I can't. But I can control what I do in doing the right thing. And I think that you know that I'm doing the right thing because I've got to make unpopular decision after unpopular decision. But I committed that I was going to do my very best in this job, and that I was always going to put our families before myself. And that's what we're doing. So I'm going to keep doing the very best that I can, making the very best decisions that I can, giving the very best recommendations that I can. We just need everybody else to the best that they can to do the right things, to not yell at each other, and to make sure that we admit what we are facing is a 1 in every 100-year worldwide health pandemic that's killed, 170,000 people in this country. It's pretty darn serious. Let's treat it as such. Thanks.